Thank you very much for being here. Today, we have sponsors for this program, EMD Serono, Genentech, Novartis, TG Therapeutics, and Alexion. Let's give them a round of applause and thank them. Thank you all. Thank you for being here. So we can't do these programs unless we have them to support our programs, which is why, we have to let you all know and be able to see them as well. Today's program, well, this is a Compass MS Care program. It's Compass MS Care Rural America. MS Views and News is the leading patient advocacy organization in the United States, providing rural programs in underserved communities. So today we have Karen Hislop. Karen Hislop is from the Huntsville area. I know she's been very active there for quite some time. She's a occupational therapist. She'll be speaking with you today about learning about how adaptive equipment and therapies can help you. So let's get this started and give her a round of applause.
Okay, well, thank you so much, Stuart. I appreciate the opportunity to be here and talk to everybody about strategies for living with MS. As Stuart said, my background is an occupational therapist, and I've worked in the field of neurology most of my career. My start in MS, I worked in an inpatient hospital, and we worked with folks with MS way back in the early 90s. And then I moved to Huntsville and started working in the outpatient clinic. And there was one patient in particular who really kind of got me hooked on MS. Her name was Paula. She was a young woman when I first met her, just starting college, very knowledgeable, very dynamic, go-getter, but she was having these symptoms that they couldn't really figure out what was going on with her. So she was admitted to the inpatient hospital for a workup. They did all kinds of testing. Then we all met for a case conference afterward, and I'll never forget that day. The leading doctor said, did all her tests. Nothing came up as being wrong with her. So she is now diagnosed with conversion disorder. And I remember my heart sank. If you don't know, conversion disorder is a psychiatric condition in which physical symptoms are manifest because of emotional or psychiatric issues. And I just wanted to cry. I thought there's something really wrong with this young woman, and now we're not ever going to figure it out because now she's been labeled with conversion disorder. So that was kind of my beginning of my real passion for working with people with MS. I was fortunate to be able to work with Paula throughout the years, and she did get diagnosed with MS. And then I remember fast forward, she was finished her degree, she was working in her field, having problems, again. We were working in therapy, and she was so discouraged. She was really down, which was not like Paula. She was normally very upbeat and happy. And she said, I have all these things that old people get, and I'm young, and nobody knows, this is terrible. Nobody knows what it's like to be a young person with all these old people problems. And I said, no, there's other people out there who have these problems too. I said, you got to go to a support group, and connect with other people who are your age, who are struggling with these things. And she's like, no, I don't want to go. I said, yeah, you have to go. I'll tell you what, I'll go with you. So, all right, if you go with me, I'll go. So we plan to meet at the support group meeting. We get there and we're the only ones there. So then it dawned on me, well, no kidding. Everybody who runs these groups has MS themselves, right? And so what happens if you have MS? You have good days and bad days, and you can't know if you're going to be able to run a support group. You don't know if that's going to be a good day or not. So I thought, I'll do it. I don't have MS. I, don't have a problem with that. So I can run these support groups, and then people can come and go as they are able to. So that was kind of my dive into being involved in the support groups. And so like Paula's story, that's the challenge, right, with MS, is that your symptoms are a lot of times unpredictable. that's MS, right? Your symptoms are often unpredictable. You've got to rule out lots of stuff. Your symptoms could be lots of other things that need to be ruled out. So for many people, it takes a while for you to figure out that you have MS. Then what happens then is you get a delay in coming with a plan for how am I going to deal with this. There's a delay in coming up with your diagnosis. There's a delay in coming up with a plan for how to treat it. And then that makes life harder than it has to be, right? So now you're struggling with this, you're thinking worst case scenario, and it makes it really a lot harder to live with MS than it needs to be. So I've got this afternoon, I've got the top 10 symptoms of MS and things that you can do, whether you're diagnosed or not. Actually, you don't even have to have MS to have these symptoms and try some of these strategies. So the top symptom for MS is fatigue. And fatigue for MS is different than fatigue for me. I work hard, I get tired, I'm fatigued, I go to bed, I sleep, I get caught up on my sleep, then I feel better. It's not like that for MS, as you guys know, right? Your fatigue is different. It's like bone deep fatigue. It's like my brain is like in sludge kind of fatigue. And it's not that I take a nap and then I feel better. And so occupational therapy can help you come up with some strategies for dealing with that kind of fatigue. Occupational therapy can help with training in pacing techniques and energy conservation techniques and identifying adaptive equipment to help you be able to cope with it. So how many people have heard of the spoons analogy? Yeah, so that's a good analogy. It's kind of like concrete, right? Black and white. The spoons analogy basically says, every morning you wake up and you got to decide how many spoons of energy do I have today. So if you're having a great day, today might be a 12-spoon day. You wake up and you're in pain and you're not feeling good, it might only be a 3-spoon day. So when you wake up, you have to decide, all right, if I'm not having a 12-spoon day, if I've only got 3 spoons today, what are the top 3 things that I want to do with my energy today? And come up with strategies for not doing the other things or saving your energy so that you can focus on the things that are important to you for that day, what you want to accomplish. And so there's lots of information on how you can make your spoons last longer. And this is a tip sheet from Living with Chronic Illness. It's just one of a number of resources that are out there. And so you want to establish your baseline. Part of it is being real about what you can accomplish and what you can't, knowing I've just got this much to do and I can't do more than that. One of the big challenges people fall into is you wake up and you have a great day and you think, man, I feel great today. I have all this stuff that I haven't been able to do forever because I feel like crap for so long. But today I feel great. And so I'm going to get all this stuff accomplished, and you overdo it. And then you pay for it the rest of the week. So knowing yourself and knowing that even though it's a great day, I got to dampen my enthusiasm and make sure I don't overdo it, or I'm going to pay for it the rest of the week. And then making sure that you schedule in rest and relaxation. Again, you're having a great day, don't want to stop, want to keep going. Make sure that you schedule in time to stop and rest. Make sure that you're getting enough sleep. One thing that's not on this list that's really important is your diet. Make sure you're spending time to pay attention to your diet. MS is an autoimmune disorder, and so it results in inflammation in your body, and so you want to make sure that you're looking at an anti-inflammatory diet to try to give you the energy that you need to keep going. Balancing things, using good ergonomic techniques, and making sure that you're communicating with your family and your friends about what you're able to do and what you're not able to do. So then adaptive equipment is a way that you can stretch that energy that you have a little bit more, gadgets and devices to help you be able to do things more easily. And so one of the big things that happens is people have trouble getting their shoes and socks on, right? If you have trouble bending over, you might just put slippers on. We see this all the time. People got little flip-flops on or little slippers on. But base of support is really important. You got to have really good shoes with a good base of support so that you don't end up falling and slipping and having problems with walking. And so there's all kinds of stuff available now to help with that. There's elastic shoelace shoes, there's reachers, there's dressing sticks, Velcro stuff. And it used to be that all of this adaptive equipment looked like you should be 80 if you're using this, but now it's looking more fashionable. Everybody's gotten hip to just sliding their shoes on with elastic laces, right? And then transfer devices. So you want to make sure that there's bed rails available, there's transfer poles available. You can use those in the bathroom, you can use them in your bedroom to help you have the support you need so that you're not falling and losing your balance. There's adaptive equipment for the toilet, a high toilet seat. If you've got weakness in your hips, it's hard to move from sit to stand. Having bars to be able to push up on helps you be able to use your arms and your legs for standing up. And then in the kitchen, arranging things in your kitchen, in your bedroom, so that the things that you use frequently are at a handy location between your knees and your shoulders so that you're not having to reach way overhead or reach way down, do deep squats 50 times a day to get your stuff out of your cupboard. You want to save that for your exercising part. And then using a kitchen cart. Instead of making 5 trips to the table to put stuff on the table, use a kitchen cart, put it all on there, make 1 trip to the kitchen table. Furniture oftentimes is not the right height. It's oftentimes low, and if you have hip weakness, that sit to stand again is problematic. And so putting your furniture on furniture risers to give you a little boost in height can be a very helpful thing to save your energy and to make it safer to move sit to stand. Again, using your arms and your legs anytime you can to move from sit to stand. Using arms with chairs with arms on them can be helpful. Another little tip that people don't think about is chairs that have that cross rail, that like bar at the bottom connecting the 2 legs together, can be a little problematic because that blocks your ability for your feet to get way underneath your hips when you're moving from sit to stand. And so if you can't get your feet underneath your hips, it makes it much harder to move from sit to stand. Okay, problem number 2, balance and gait. That's oftentimes an issue with MS, and it's usually a storm of your other symptoms. It's because you have weakness, you have spasticity, you've got loss of sensation. So physical therapy can help with balance and gait by prescribing exercises for strengthening, managing your spasticity with modalities, and fitting you with mobility aids to help you walk better. So one of my favorite balance devices that we've got is called the Bioness Bits, and there's other systems out there. But what it does is there's a platform that you stand on. It's mobile. And on the second slide with the fellow, he's got a monitor on his belt that tells him where his center of gravity is. And so his exercise, there's an X on the gray box in the screen, and he's got to keep his center of balance in the box, and then he's got to try to move his center of balance down one path and back and down the other path and back. So that involves being able to make postural adjustments, controlled postural adjustments, to train you to know where your center of balance is. And on the exercise that the woman's doing, she's added visual scanning and dual tasking to her balance exercises. So in addition to keeping her balance, she's having to scan a fairly large screen, and then she's got to think about dual tasking is a cognitive-ish task where you're having to think about doing a cognitive function, like, for example, 1A, 2B, 3C, while you're scanning, while you're keeping your balance. So that's part of what I really love about this system is you can work on each piece separately, the visual scanning, the dual tasking, the center of gravity, and then you can put it all together and have it work on it all at once, because that's when problems with balance usually happen. It's not when you're paying attention. It's when you're thinking about, oh my gosh, I've got to go get this, and you're walking at the same time, and that's when you end up in trouble. Other mobility aids, AFOs have come a long way. A lot of AFOs now are carbon. They're very low profile. The fellow running, if you didn't know better, you might almost think he had kinesio tape on instead of a brace. But that can be very helpful for foot drop. It's really exciting to see all of the robotic stuff coming along. In the center picture, there's hip assist. Right now, robotics is out of most people's price point, but it is coming down. They are making advances in robotic technology, and I think that will be something that will be an affordable option for people in the future. In the meantime, we've got the old-fashioned rubber bands, right? So we do have ways to help with hip flexion if we need that. And then the Biodex walk aid is super cool. We just got one of those in our clinic. What it is, it's a harness that you put around your pelvis, and then the bars lift you up to take your weight off your feet. So you're semi-suspended, and you can unweight somebody up to 70% of their body weight. And then that allows you, if you've got weakness in your hips and legs, that allows you to be able to advance your foot. And then as you gain strength and are able to walk more, we can lower the amount of weight that you're bearing. We can go from 70% suspended down to 40, 30, until you get to the point where you're able to walk without that suspension assist. So that's really cool. Then there's all kinds of gadgets for mobility aids and transportation. So this is where we usually say, oh man, I don't want to have to give in to using a wheelchair or walker or that kind of thing. But again, go back to your spoons analogy. If it takes, like Paula, we had this discussion, you got 4 spoons today, and if it takes 3 of your spoons to walk from your car to your desk at work, that leaves you 1 spoon left for the day. And so again, mobility devices have become much lighter in weight. They've become much more attractive looking, less medical, more cool looking. And so that's something that it could be very helpful. Now, the electric wheelchair in this example is not covered by insurance, but again, they've come down in price and are affordable for a lot of people. Now, full up power wheelchairs and wheelchairs are covered by your insurance, and so that's another option as well. Okay, symptom number 3, spasticity, numbness, and tingling. And so most people with MS experience numbness, tingling, spasticity at some point in their life. And so there are some things that we can do to help with that. In physical therapy, we use cold laser. It's also called red light therapy and E-stim. And cold laser is red light, and it goes through your tissues through a wand there. And what it does is it stimulates the mitochondria, fibroblasts, and other cells in your tissues to eat up some of the garbage, the waste products that are in there, and it helps to reduce inflammation. So it can be very helpful in decreasing pain. For some people, we have improvement in sensation with neuropathy. So that's a modality option. And then we've used E-stim for years and years. There's TENS, which stimulates your sensory nerves. So it doesn't actually create a muscle contraction, but it fills up your sensory nerve with information and kind of masks the pain signal that's going through your sensory nerves. And then there's E-stim that actually creates a contraction. Russian stim is one. So if you're having problems with spastic muscles, the idea is that you contract that muscle really hard, fairly frequently, and it exhausts that muscle, and so then it stops spasming once the muscle has been exhausted. And these are all things that if they work for you, even the lasers, again, they've come down in price. So if you try it in therapy and it's working, it's for most people affordable to buy a home unit, and you can do it at home. All right, symptom number 4, weakness. So weakness happens when the nerves are not innervating your muscles aren't contracting like they used to, and then they get weak. And so physical therapy helps with gaining strength back. There's different types of exercise. Aerobic exercise is the kind that gets your heart rate up. That happens when you're doing walking, biking, jogging. And you want to, with exercise, the caution is don't do anything in excess. Again, people's tendency is like, I'm so sick of having MS, I just want to be back to my old self. And so then they overdo it with their exercise and end up in worse shape than if they hadn't done it. So moderation's the key. You want to work hard enough that you can still talk, but not sing is one key for how hard you're working. And you want to ideally do it for about 2.5 hours per week. So stretching's a great exercise. That's a great way to maintain your range of motion and helps with decreasing spasticity. Yoga, Pilates, Tai Chi are great ways to exercise. And so doing that for about 10 minutes a day is the idea behind that. And then there's resistive exercise. Resistive exercise helps you gain strength. So resistive exercise, you can use rubber bands, you can use weights, you can use machines. Again, moderation's the key. You don't want to overdo it, and you want to do it about twice a week. So problem number 5, vision problems. So for many people, their first symptom of MS is optic neuritis. And it's a sudden change in how clearly you can see, if you can see colors. A lot of times there's pain in your eye. So you would want to be checked out immediately and make sure your retina is not detaching, because if that's happening, you need that fixed right away. And then once they've made sure your retina is okay, once they determine it's optic neuritis, typically you get treated with IV steroids, which for most people resolves your pain quickly, and then your vision slowly starts to come back. Unfortunately, for some people, their vision doesn't come back. And so in that situation, occupational therapy has low vision therapy as one of the tools in our tool bag to help people figure out how to deal with vision loss. We look at lighting, contrast, and magnification. So when we're looking at lighting, we talk about different types of lighting. There's LED lighting, there's incandescent lighting. We talk about where the lighting's positioned to make sure that you're not getting glare, and making sure that you've got illumination to optimize the vision that you've got. We talk about contrast. Carpets, like this carpet, is really busy. If you've got visual impairment, it could be really hard to see if there's a step or if there's something that you've got to step over. So you want to be careful about busy patterns in the carpet. You want to make sure there's contrast with edges. For example, on the stairs, putting a yellow line on the edge of the stair to make sure you know where the edge is. Problem number 6, dizziness and vertigo. So some people end up with feeling lightheaded. Some people end up feeling like the room is spinning. And so physical therapy can help with BPPV, benign proximal positional vertigo. We'll talk about that more in a minute. And then exercises to help with dizziness and lightheadedness. So benign proximal positional vertigo, that's an inner ear issue. What happens is your inner ear has these little canals that are filled with fluid and when the fluid moves in your inner ear, it tells your body where you are in space. Sometimes debris gets in that fluid and throws everything out of whack, and that's where your dizziness comes. So this is a particular treatment, a maneuver where you turn your head a certain way and then you drop somebody down and you turn and roll. And what it's designed to do is get that debris to settle back down so it's not floating around in your semicircular canals. And it can be very effective in reducing vertigo and dizziness. And then for some people, exercises in which you're walking and doing head turns and visual gazing while your body is moving is the exercise of choice for some people with dizziness and vertigo. Problem number 7, cognitive changes. So we joke about that every month at our support group meeting. We need name tags because we can't remember anybody's name, even though we've known them for like 15 years. So that's a very common thing to happen with MS. So cognitive, so speech therapy can help with cognitive retraining to improve your memory, to improve your organization strategies, problem-solving skills, and they can help you figure out which of the zillion apps and things out there is going to be the one to help you. So examples of memory strategies, here's a little handout. Tips, think about what is the key idea. Think about trying to link things together to help you to remember, chunk things together, make a list, rehearse, repeat in your own words what was said that you're trying to remember, visualize, and draw it out are some tips to help you with your memory. Organization strategies, again, there's a zillion apps out there. There's a zillion different types of planners out there. And so your speech therapist can help you figure out which is the one that's going to work best for you. If you're like me, it changes all the time. I got this strategy's working for me for a few months, and then I tweak it and I use a different strategy. Time management is a real issue. Using timers to help you stay on task and stay on time can be a very helpful strategy. Okay, problem number 8, speech problems. So about 25 to 40% of people have problems with speech. Either their speech is slurred, they have loss of volume and people can't hear what they're saying very well, or they have stuttering. So speech therapy, again, can help with that. And so what we do is one of our favorite programs for volume is the LSVT Loud program. It was originally designed for people with Parkinson's disease, but it turns out it works great for people with neurological problems of all kinds, with stroke and brain injury. And the idea behind that program is that people with neurological issues tend to shrink over time. Your posture tends to kind of shrink, your voice tends to shrink, your steps shrink, and the LSVT program is a specific program of exercises to try to increase the amplitude of your movements, of your breathing, of your voicing, of your stepping. It's a whole body approach to try to increase your amplitude, and it works really well. Problem number 9, swallowing problems. So swallowing problems are called dysphagia, depending on what part of the country you're from. And they can result from muscle weakness. You know, as we've talked about, MS can attack anywhere in your body. You can get weakness in your hips, but you can get weakness in your muscles in your throat and your neck. And so speech therapy can help you if that's your issue. We start with a flexible endoscopic evaluation typically, and then once we figure out where your issues are, then we can target exercises to that part, to those muscles that we need to focus on. So the flexible endoscopic evaluation, or FEES is what it's called for short. There's also a barium swallow. It's not the only way that you can test your swallowing, but this is the one that we like to use because it's very convenient. We can do it right in our office. It doesn't require special equipment. Well, it does require special equipment, but it's equipment that you can carry with you to different clinics. But it involves putting a camera that's on a scope down your nose into your throat, and then you eat and drink food items of different consistencies, and you can actually see what's happening in your throat. So we can see which muscles are working, which muscles aren't working, and then we can target exercises to the ones that we need to do. And then one of our favorite exercises for dysphagia is synchrony. And This is a biofeedback tool. We put electrodes on your throat, and it lets you see how you're doing with your swallowing. So before we had Synchrony, we would cue people, swallow harder. I think maybe you're swallowing. You're not so sure if you're swallowing. Can't really tell. But now we can tell, right? Because there's a bar graph that shows not only if you're swallowing, but how hard you're swallowing. So one of the challenges if you have dysphagia is the exercises are, first of all, extremely boring. And then second of all, it's really hard to tell sometimes if you're making any progress. So with Synchrony, you can see, people will say, I don't know about these exercises. I don't think they're doing me any good. We can compare and say, okay, this is what your bar graph looked like when we started, and this is what it looks like now. So you are, in fact, getting stronger. And then the other thing is you can play games with it. So on the top picture, I don't know if you can see, but there's a little kangaroo in the picture. And so the game is you have to swallow hard enough to make the kangaroo jump up into the tree and grab the fruit out of the tree. So if you don't swallow hard enough, he can't get up into the tree. So they're silly little games, but they sure make the exercises more entertaining and more interesting to do on a repetitive basis. The other thing it does is it kicks into that neuroplasticity theory, right? So you've got you've kicked into using your competitive spirit. You've kicked into trying to accomplish something, and all of these things help then those changes in your brain to lay down more permanently, faster and stronger in your brain. When you can add fun, competitiveness, increased repetitions, that kicks into neuroplasticity and helps it to be more effective. All right, last symptom is depression. So many people with MS have the severest form of depression, clinical depression, and people with MS have clinical depression more than people without MS do. So what can you do about depression? So support groups, right? So support groups are one way it's not the only way, of course, but one way that can really help battle depression. You're meeting with people who know exactly what you're going through. They're in the same boat. You can talk openly and honestly about what's happening. Sometimes you don't want to burden your family members. You feel like, they do so much for me. I have to depend on them so much already. I don't want to add this extra layer of burden onto them. You can talk to your friends and tell them things that you wouldn't necessarily want to share with your family. And so these are pictures from our support group, and we meet on the third Tuesday of the month at 6 o'clock at Therapy Achievements, and it's open to anybody, anybody with MS, anybody with a loved one with MS, and we welcome you to come and join our group to get some support for how do you live with MS. So to wrap it all up, how do you live your best life with MS? You keep active, right? And so you want to make sure that you're mindful of the factors that create fatigue, mindful of the factors that put you at risk for falling, and make sure that you're balancing your life out so that you can participate in as many activities as possible and live your best life possible. So thank you so much for listening to my talk. Are there any questions?
Let's first thank Karen. Person writes that, of course, they have a lot of energy in the morning, but how do they learn to manipulate it so that way they have energy in the afternoon as well?
So that goes back to the pacing techniques. First of all, you need to know your pattern. So you already know I'm great in the morning, but I peter out by the afternoon. Pay attention to what time it is. When do I start to lose my steam? Pay attention to what am I doing in the morning that might be using up more energy than I need to. And then make sure that you're scheduling time to rest. So if I know that I'm going to start losing my steam by 1 o'clock, I want to rest before I lose my steam. So I might need to take like a little afternoon or a little late morning nap or late morning break to make sure that I'm not all the way depleted before I stop and rest.
Thank you for the program.
Oh, yeah.
I always learn things at these programs, and I've learned some things. Thank you so much. One of the things that I've observed over the years is shoulder destruction from pushing on those bars and using the walker and supporting their weight on the walker as opposed to a stand-up walker or something like that. So I'm trying to be mindful of shoulder preservation, because when individuals have surgery, already have difficulty walking, they may not get back to walking again, because when they're out of it for 6 months, it may be that's it. So do you have any strategies, or I think it would be good for us
That's a great question,
to get
we
one?
see that too, especially for our spinal cord injured patients. We really have to be careful about protecting their shoulders. And so one strategy is to start sooner than later with lower extremity mobility devices, with AFOs and supports for foot drop and supports for hip weakness, so that you're not relying only on your arms for moving your legs, but you've got the support that you need for your legs. The second point is to work with someone who knows how to adjust your walker and your cane to the right height. A lot of times people will just go to a drugstore and get a walker, and they have no idea what height it should be. This feels pretty good, but work with someone who knows about biomechanics and knows how to adjust your device so that it's not putting stress on your shoulders. And then also working on different techniques of using it. If my arms, like for example, if I'm in a wheelchair and I'm propelling my wheelchair and it's not configured properly and my arms are behind me, that's going to put a whole lot more stress on my shoulders than if I've got it configured where I can get the most push on a correctly configured wheelchair.
Question: where would somebody be able to get that the measurements done correctly?
So I would ask your physician for a prescription for physical therapy. Your physical therapist, they're a doctorate level now. They spend tons of time in school figuring out how to do things to the best biomechanical advantage.
What can you tell us about, I've seen online where they have different robotics that people are now hooking up in their kitchens to help them stay upright and yet attached to something so they're tethered and they can get out of their wheelchairs and stand and do things in the kitchen.
So that's similar to the Biodex mobility device that we have, where it's kind of helping to lift you up. When they first came out with those, they were really expensive. They were like thousands and thousands of dollars, and pretty much only clinics could afford them. But as technology improves, they're coming down in price, they're coming down in size and weight, and becoming more affordable for people to use in their home.
I just had a question about when you're walking with a cane, excuse me, when you're walking with a cane, what side I broke my right foot, and so I was walking with the cane. What side of the body do you put the cane on?
So if you want to put the cane on your weak side. So if your right foot is the one that you have the trouble with, what you want to do is you're going to take a step. Let's see if I did this right. So I could have got this backwards. So you want to take a step forward with your left foot and your right cane, and then I said that backwards. So it would be let's say my left foot is my weak one. I want to step forward with my left foot and my cane, and then I have the support of my arm as I move off of my right strong foot and onto my left weak foot. I have the support of the cane to help me.
Hi, I live in Huntsville, and I missed the details about the meeting. Is there a flyer here or
yes,
a website we could go to?
I've got little cards out in the lobby that list when we're meeting, and there's also a drawing. I forgot to tell you guys about that for a free massage. So if you fill out the little card in the lobby, you can check off to get more information about all the stuff that I talked about today, and you can also be put in the drawing for a free massage.
If you suffer from numbness like I do in my hands sometimes, with physical therapy right now, that's not something my insurance will cover. So what are some things I can do at home to help with that?
So numbness and tingling is really challenging because outside of medications and some of the modalities, there's not really a lot of options for treatment. And so one of the things you can do is to be mindful about not putting extra stress on your joints to further stress it. Anti-inflammatory diet to make sure you're not increasing inflammation. And then a lot of times you can get a discount for paying out of pocket if your insurance doesn't cover therapy, but you just want like one session to figure out how to deal with this. You can get a cash discount and set up an appointment. Like I said, in our clinic, everything's geared toward how do you manage this at home. And so if you could try the laser, and then if it worked for you, it would be something that we could help you figure out if you can get it for home use.
Yeah, as far as like pacing yourself, you were saying that so in the morning times you may get wore out, or evening times. Could you like so a part of the day, say first part, work for 2 hours if you can, and then rest for 2 hours and just alternate like that? Would that help?
Yep. So every person is unique. And so the first step is to pay attention to yourself, and so for some people, 2 hours work, 2 hours rest, 2 hours work, 2 hours rest is going to be the ideal thing. Other people, it might need to be shorter, work for an hour, rest for 15 minutes. Then I can work for an hour, rest for 15 minutes. But that's part of the challenge of figuring out your personal pacing techniques. What's your energy like? What's your best time of the day? How much time does it take you to recover? And what are your signs? Pay attention to, I'm starting to get tired. If I stop and rest now, it won't take me as long to recover than if I push myself and totally wipe myself out.
How do we even begin to try to explain our limitations on these days where this challenge is?
So that's a really great conversation to have with your therapist if you're working on strategies. If you're not in therapy, with your support group. Pretty much everybody in your support group has dealt with trying to explain this to my family and feeling like my family doesn't really get it. And so they would be a super resource to help you figure out, how do I try to explain this to people?
With the spoon system or whatever you call it.
Yes.
How do you explain that at work? Because I work 6 hours and I get a 30-minute break, and that's it.
So using the spoon analogy is helpful to people who don't understand, because it makes it more concrete. You've got a certain number of spoons, and working with your employer on, how much time do I need to spend at work, and then how can I schedule my work to get my work done but have the kind of breaks that I need. Other strategies I've used are like blocks, like I've used blocks and stacked them up to kind of do a concrete example of, this is how much, if you use those 1x1 blocks, it takes me 3 blocks to do this and 2 blocks to do this, and I only get 8 blocks a day. So that's another way to analogy you can use besides spoons is like the 1x1 blocks.
Hi, Karen.
Hi.
Just a quick question. How do you get insurance to pay for massages? Because it's not a spa day for people with MS. It's very therapeutic.
Right.
When we have those deep tissue massages. So I know, it's kind of like a cosmetic thing or a spa day.
Not really, because spasticity is a medical issue. MS is a medical diagnosis, and spasticity is a medical issue from MS. And so in our clinic, we can bill physical therapy for some of the myofascial release and the manual therapy things. It gets tricky, to do it on a monthly basis. But what we do again is we show you the techniques, try to help you find tools to be able to do some of this on yourself. I appreciate that it's not quite the same doing it on yourself as having a therapist do it, but we do work with you on trying to figure out how do I manage that spasticity and that pain, and it is something that we can bill as myofascial release or soft tissue mobilization.
Great. Thank you very much, Karen. Come on down. My thanks to all of you for coming. My thanks especially to the sponsors of our program. We have EMD Serono, Genentech, Novartis. We have TG Therapeutics and Alexion, and I just want to thank them for doing what they do to make sure we could do our programs. Have a great day, everybody.